years ago, Community Health System went from recording patient information on paper charts to implementing what would become the gold standard in medical records, an electronic software system called Epic. 15 years ago, when Dr. Hagop Afarian was entering his career as an emergency department physician, he would take patient notes on a piece of paper. And if he needed medical history on patients coming to the ER, that was a bit more challenging.
What would have taken hours to days in the past to achieve by calling up medical records from our own department or calling up medical records from outside facilities, we now have at the push of a button across the nation.
But now, thousands of providers in the Central Valley, including the entire community health system, use Epic.
At the click of a button, I can tell what illnesses a patient may have, what medications they're on, what allergies they have, what tests have been done, what therapies have been given.
Jaime Franklin is the Chief Information Officer at Community Health System. He helped implement the revolutionary tool 10 years ago.
It was one of the biggest transformations that we have done within community in the last few decades. One of the primary drives of having an electronic health record is to make sure that your patient information is up to date and immediately available to any care team that needs to care for you, regardless of where you are, whether it's within the community health system or beyond, if you are traveling, etc.
Jaime says patient care is always a top priority. If a physician can easily access patient information, that physician can more efficiently care for the patient.
We're trying to make their day-to-day process better.
For Dr. Afarian, who works in the emergency department, easy and immediate access to patient information is crucial.
We have a lot of patients that arrive who may be unconscious or unable to tell us what's going on or what their history is. What we can do by looking in the healthcare or the health record, the patient's chart, we can see immediately what illnesses they may have, what medications they're taking, what allergies they have, and how to save their life with that information.
Through Epic, patients also have access to their own medical information right at their fingertips.
Through a tool called MyChart, you as a patient can access your health records right there on your phone. You can see what the physician thought when they examined you last, what their plan is, what medications they've ordered. All there right on your phone or on your computer.
Patients can access their MyChart by downloading Community's My HealthMate app from the Apple Store or Google Play.
At Community Health Systems, what's been developed is a one single app that's called My HealthMate. And we, in addition to information that's core to the patient record, there's other information that's helpful for patients.
Jaime says he's so proud of how Community's team and Epic have shaped patient care for the better in the last decade.
So 17 million times, a caregiver was able to make a care decision based on the most current information for the patient, regardless of where the patient has been seen.